Thank you for taking the time to join us for this video with Professor Stefan Schug, entitled Prospect Guidelines to Improve Postoperative Pain Management. The incidence of postoperative pain remains a burden worldwide across both developed and developing countries. The current reality is that postoperative pain management is suboptimal. For example, in the US, 80% report pain after surgery, with 88% of these reporting moderate to severe or extreme pain levels. Given the burden of postoperative pain, it is imperative that patients' postoperative pain management is optimized. Optimal postoperative pain management should also be implemented to potentially reduce the progression to chronic pain. The procedure-specific pain management prospect collaboration of anesthesiologists and surgeons was formed to provide practical and evidence-based recommendations for management of postoperative pain, specific to different surgical procedures. This video of Professor Schug, founding member of the Prospect Working Group, will now highlight key aspects of the recommendations and their implementation.
What is Prospect? It is an organization providing evidence-based guidelines for postoperative pain management. It is very important to realize that different surgical procedures cause different pain states. Think about a total hip joint replacement, mainly musculoskeletal pain, via an abdominal surgery, mainly visceral pain. They are of different severity. And that explains why we cannot say every postoperative patient should have the same approach to pain, but we need to say you need to look at the procedure and then identify what is the right approach for this specific surgical setting. And this is exactly what Prospect is doing. We have created guidelines for better postoperative pain management. Prospect is an old organization going back over 20 years. We were recently put under the auspices of the European Society of Regional Anesthesia and Pain Therapy, ESRA. What we have done over the years is that we have selected commonly done operations in a wide range of areas of surgery, from gynecological to urological to abdominal to orthopedic to now ENT. With all of our procedures, we have usually a peer-reviewed publication in a journal, which gives you the background but also gives the scientific credibility for this approach. You will get all the information on this operation, what can you do to improve pain relief, what is the best approach, and so on. We are not advocating an opioid-free approach to pain relief, but we are advocating an approach which is opioid-sparing, but you may still need opioids for rescue analgesia. So how can you implement something like Prospect guidelines in your hospital? You need to make postoperative pain management an issue in your hospital. And you should have a champion, a local champion for that. It is also important to involve nurses, physiotherapists, and pharmacists and teach them about this approach, because this will facilitate and encourage use of multimodal analgesia. You can, last not least, also speak with your management about postoperative pain relief, because you can discharge patients earlier from the postoperative ward if you do pain management well, and that saves money. One of the recommendations I can give you, which has been very successful in a number of hospitals, is you print out the summary recommendations. It's a 1 or 2 page document. You laminate them and you put them into your theaters and recovery room. And to facilitate that, you see here that they are not only available in English. So this is my idea about how you implement Prospect into your hospital.
Thank you for watching this video with Professor Schug on the Prospect Guidelines and how they can be implemented. Evidence has shown that implementation of optimal postoperative pain management can lead to multiple benefits for patients, including reduced postoperative pain and postoperative complications and increased early ambulation and early rehabilitation. By optimizing these patient outcomes, hospitals can facilitate a better patient experience, reduce patients' length of stay, as well as lowering their costs. Prospect provide evidence-based, procedure-specific pain management recommendations. The Prospect guidelines cover commonly performed procedures and are easy to access, pragmatic, and available in multiple languages. The Prospect guidelines advocate the use of multimodal analgesia for optimal postoperative pain management and are published in peer-reviewed literature.